Okay, we're here today at the Slatington Public Library. It's August and we're doing our monthly sweet spot presentation. I'm Ed Bechtel from Bechtel's Pharmacy, and today we're going to talk about prediabetes. We'll just do a little review of some of our diabetes facts. As most of you know, there are two main types of diabetes, type 1 and type 2. In type 1 diabetes, your body essentially doesn't make insulin, and you have to take insulin from an outside source in order to live. Type 2 diabetes, your body can still make insulin, but it doesn't use the insulin properly. If you're not sure what kind you have, we can talk about it afterwards. You can usually tell by whatever medications that you're using. So what should your blood sugar be? Fasting blood sugar, which usually most people take first thing in the morning, should be between 70 and 130 or 70 and 125, depending on whose guidelines you follow. And then after you eat, your sugar may go up to 180 an hour or two after you eat. When it goes above 180, that's the point at which the extra sugar in your bloodstream becomes toxic and can damage the blood vessels and the nerves. So, okay. Now, how do we control blood sugar? It's a three-pronged approach: diet, exercise, and medications. Each of those is as important as the other. And you'll note that 2 out of 3 of those are under your control. Medication is somewhat under your doctor's control, but even that, you have to take the medication the way your doctor prescribes it in order for it to work. So that's kind of under your control too. Do you have prediabetes? If you answer no, are you sure? Prediabetes usually indicates that your pancreas is not producing the required amount of insulin to take the blood glucose out of your bloodstream. Your blood glucose levels are high, but not high enough for you to be considered diabetic yet. Today we'll take a look at the prevalence of prediabetes and type 2 diabetes in the United States. Next, we'll quickly cover the potential long-term complications, then discuss practical ways to prevent type 2 diabetes, including increased physical activity and healthy eating. It's important to take a look at the statistics related to prediabetes in the United States. Today they estimate that there are 84.1 million people in the United States with prediabetes. 9 out of 10 of those don't know that they have prediabetes. The rate of newly diagnosed cases of type 2 diabetes is rising at an alarming rate. It's projected by the year 2050, almost 1/3 of the United States population will be diagnosed with type 2 diabetes. When I was in college, that was before they called it type 1 and type 2. They called it juvenile diabetes and adult onset diabetes. And typically type 2 diabetes was diagnosed in people who were in their 40s and 50s and were overweight. Juvenile diabetes more often in kids, but as we've learned over the years, those two names, those were misnomers. Type 2 diabetes can happen anytime during your life. My wife was 53 when she developed type 1 diabetes. Type 2 diabetes now we're seeing in teenagers. So it's not people in their 40s and 50s anymore. It can be anywhere on the life spectrum. So not only are the number of patients diagnosed with diabetes increasing, but the cost to treat the disease is also rising. $245 billion, the estimated cost of the United States treating diabetes. The average medical expenditures for people with diabetes is about $13,000 a year. About $7,900 of this was attributed directly to diabetes. After adjusting for age and sex, the average medical expenditures among people with diagnosed diabetes was 2.3 times higher than for people without diabetes. Now, some of that isn't necessarily all bad. We're getting better at treating diabetes, and we're keeping more people from getting complications. There's been a trend downward in the number of patients on dialysis for the last few years, and that's because for the last 20 or 30, we've been working hard to control diabetes. But the numbers of people getting diabetes, is pushing that total number higher. So what are some of the complications of diabetes? The risk of developing these complications increases as control of diabetes decreases. In addition to those listed here, patients with diabetes are more susceptible to other illnesses and depression, and are also more likely to be less physically active. Blindness, kidney disease, nerve damage, impaired circulation leading to amputation, heart attacks and strokes are all people with diabetes are at increased risk. We cover complications in another class. So what are the risk factors for type 2 diabetes? It's important to be aware of the risk factors associated with the development of type 2 diabetes. Patients who have multiple risk factors are significantly more likely to develop diabetes at some point in their life, especially if preventative measures are not taken. So if you have a family history of diabetes, heart disease, you're overweight, you have a sedentary lifestyle, you're Black or Hispanic, might not be politically correct, but race plays a difference in development of diabetes. Elevated triglycerides, decreased HDL, a low level of the good cholesterol, a history of gestational diabetes, delivery of a baby over 9 pounds, and polycystic ovary disease are all risk factors. If you're in this class today, chances are you have one or more of these risk factors. There's a place on your handout to jot down your own risk factors. Some of these you can control, some of them you cannot. You can't pick your parents. The heredity, is something that you can't control. But the amount of time you sit watching TV, or the amount of potato chips that you eat while you're watching TV, those are things you can control. You might want to circle the risk factors that you can do something about. So let's take a look at obesity in the United States. This topic is especially important because obesity is a risk factor that you can manage. There are several factors that may be contributing to the rise in obesity. Some neighborhoods may not have adequate sidewalks. or parks to encourage physical activity. We're in the age of technology where everything happens at a rapid pace and is available at our fingertips. Many of us have busy work schedules and don't get enough sleep. Healthy foods may be more expensive to buy than junk foods, and some locations don't have access to healthy foods. Also, the size of our plates and our portions of food have significantly increased over the past few decades. So the lab values for common markers used to diagnose diabetes are listed on this slide. These are not the only ways diabetes is diagnosed. It's important to point out that people who fall between normal and diabetes are considered to be at risk of developing diabetes. If you or someone you know fall into this range, now's the time to prevent overt diabetes from developing. So you see a normal hemoglobin A1C, which is a measure of your average blood glucose control over the last 90 days. Normal is below 5.7. 5.7 to 6.4 is considered pre-diabetes or puts you at risk of developing type 2 diabetes. 6.5 or above, then you meet the criteria to be diagnosed as having diabetes. Fasting blood sugars under 100 is normal, 100 to 125 on multiple occasions. One test isn't, indicative, but multiple occasions, that would be pre-diabetes, and 126 or above, that would be diabetes. And then after you eat, normal is below 140. From 140 to 199 is considered pre-diabetes, and then a postprandial blood sugar over 200 is considered diagnostic for diabetes. Typically, your doctor will do blood work screening. They'll do the fasting blood. They'll have you come in for blood work fasting, and they'll do the fasting blood sugar. If that's elevated, then they'll look at the A1C, and A1C is more, it's a better long-term measure and is used more often for diagnosis and to see if your treatment's working. So what can you do? Now that we know that type 2 diabetes is becoming increasingly common and can impact us financially as well as physically, here's a look at some of the strategies that have been proven to prevent the development of type 2 diabetes. Two groups have put out recommendations on ways to prevent diabetes: the American Association of Clinical Endocrinologists and the American Diabetes Association. Overall, they both agree that changing our weight and the amount of physical activity we get is crucial if we want to be successful. Other recommendations include controlling risk factors such as high blood pressure and cholesterol, as well as adding medications for certain people. They found that a weight loss of 5 to 10%, no matter what your starting weight is, decreases your risk of going from prediabetes to type 2 diabetes. So even if you are, grossly overweight, 350 pounds, if you're 350 pounds and you lose 5% of your weight, 17 and a half pounds, that will decrease your risk. Lifestyle modification is the most effective way to prevent the development of diabetes. Losing approximately 7% of your current body weight and incorporating at least 150 minutes of physical activity every week, in addition to eating healthy, has been shown to reduce the risk of diabetes by over 50%. Right now I'm doing here at the library on Monday nights a lifestyle modification course we started a couple months ago, and we're 8 weeks into it. I'm looking at starting a second group next month, but the goal in that is to lose 7% of our body weight and ramp up our exercise to 150 minutes a week, and do it gradually, lose the weight slowly, develop new habits that are sustainable. I mean, to me, diet is a bad word because diets end. I mean, lifestyle modification is something that you can carry forward and do your whole life. Okay. Isn't it amazing? A healthy lifestyle in comparison to metformin alone is almost 40% more effective at treating prediabetes. So they did trials and they compared the lifestyle modification course, and the University of Pittsburgh, where I did training on the course that I'm doing, they were part of a nationwide study. And what's amazing to me is that this study was done over 20 years ago, and people really didn't pick up on it. But they compared, using lifestyle modification to using medication to doing nothing at all. And they found that lifestyle modification actually worked better than medication. Although, people want the answer to be in a pill. Pills are easy, but if the pills don't work as well as changing your lifestyle, then okay. You should not go more than 2 consecutive days without doing physical activity in order to maintain the benefits. And aiming for 30 minutes a day, 5 days a week is a reasonable way to meet that 150 minutes per week. Now, a lot of times people will think that if they have prediabetes or type 2 diabetes that they need to stop eating all carbs. Well, it's not necessarily the case. Eating healthy is essential in addition to increasing physical activity. Combining these two helps to facilitate weight loss in a healthy, more sustainable manner. Reducing the amount of calories you eat daily is important, especially eliminating sugary beverages such as juices or soda, and reducing the amount of dietary fat. Another thing to keep in mind is to increase the amount of dietary fiber that you get each day. The American Diabetes Association recommends approximately 14 grams of fiber for every 1,000 calories you eat each day in order to prevent the development of diabetes. Daily caloric intake target varies by your current weight, but it's usually 1,200 to 1,800 calories. If you go below 1,200 calories a day, it's almost impossible to get all the nutrients that you need. And one way of setting a target, on average, they say that if you put a 0 behind your current weight, that's approximately how many calories the average person at that weight needs to take in to maintain their weight. So if you're 250 pounds, that's a 2,500 calorie a day. Now to lose 1 pound is equivalent to 3,500 calories. So to lose 1 pound a week, you need to cut 500 calories a day out of your current diet. So if you're 150 pounds, that would mean 1,500 calories. Wow. Yeah, you don't want to go below 1,200 though. Well, so you'd have to burn off an extra 200 calories and eat 300 less. Foods high in sodium, such as canned vegetables or pork products, can increase your blood pressure. Also, foods high in saturated fat can increase your cholesterol. It's important to control these conditions too, so be sure to avoid and limit your intake of these foods. If canned vegetables are used, rinse the vegetables first and cook them in fresh water. Avoid or limit frying foods. Try to bake, broil, or grill more to reduce fat. A few years ago, the federal government did away with the food pyramid. We all remember the food pyramid that we learned, and they replaced it with what they call My Plate. And if you look at My Plate, you know, half the plate is fruits and vegetables, and the other half is your grains and protein. A balanced plate is a healthy plate. Try to incorporate a variety of foods with each meal. The plate method is an excellent way to stay balanced with variety as well as portion control. In addition, remember that incorporating 30 minutes of physical activity most days of the week is important for your balance. Metformin is a common medicine used to treat type 2 diabetes. It's the most effective medicine at preventing diabetes. Really the only one that I know of that they use for pre-diabetes. However, it's not for everyone. Again, lifestyle modification should be the backbone of any prevention effort. But metformin can be considered in high-risk individuals, including those people with multiple risk factors for developing diabetes. Metformin has been shown to be more effective in individuals who are obese, less than 60 years of age, and have elevated fasting blood sugars. There's no better time than now to begin making changes to improve your health and prevent diabetes. The first step is evaluating your diet to see what you're eating and how much. Keeping a food journal for a week or even a couple of days is an excellent way to evaluate your diet in order to begin making changes. Knowing portion size and limiting caloric intake is important when trying to eat healthy. Be sure to eat slowly and avoid skipping meals, as this will help prevent overeating. Don't forget to incorporate physical activity into your daily routine. The higher the intensity level, the more benefits you'll get. Start slow and make small changes. These tend to be easier to keep up with. If anybody's interested, I do have the food journals that I use with the lifestyle modification program. I have some here. I can give them to you after the class. And there's a book that I sell at the pharmacy called The Calorie King, and in that it has nutritional information on just about everything you can think of. Fruits, from fresh fruits and vegetables to McDonald's and Taco Bell, the whole gamut. You can look up what you're eating, the fat grams and the calories, and there are many resources available online with information about pre-diabetes. Here are a few. National Diabetes Education Program, the American Diabetes Association, the Joslin Diabetes Center, Center for Disease Control and Prevention, and the United States Department of Agriculture. The American Diabetes Association provides a risk assessment tool that's free. The paper version is displayed here, but the assessments can be completed online at www.diabetes.org. When we're done today, you can walk down and get on the computers and take that test. And if it indicates that you may have prediabetes, then you may want to go see your doctor. If So now's the time to determine your risk for developing type 2 diabetes. Don't delay. And once you know your risk, you can reduce it by increasing your physical activity, losing 5 to 7% of your current body weight, and eating a balanced diet. And there's the recipe for our bacon cheddar muffins. That doesn't sound very healthy, but